that MedStack? Yeah. Shout out to MedStack and shout out to HealthTO. Thank you guys all so much for being here. I'm Linda. I'm the lead data scientist at Memotext. We're a digital health company. And
my name's Au-Yeung. I'm project specialist at the SE Futures team at SE Health.
So today we couldn't be more excited to be here in front of you all to present on the Ring of Support. So this is an Alexa-based solution for seniors, and we're really tackling the problems that we're experiencing in the aging space. Today we want to talk to you about how this industry clinical partnership came to be and what exactly we're doing. So a little bit more background on us. Memotext is a digital health company. We've been around since 2012, and we develop patient engagement programs that go through text, they go through voice calls, chatbots, smart assistants, you name it. And so we work on problems like helping patients adhere better to their medications, coordinate their care, and teach them more about their health condition. This is our first venture into the aging space, and how it all came to be was last year we got a grant from the Center for Aging and Brain Health Innovation powered by Baycrest, and we were able to meet an amazing clinical partner, SE Health.
And for those of you who don't know, SE Health, formerly known as St. Elizabeth, we're a non-for-profit social enterprise with our core business being community nursing PSW services. Obviously, with 110 years of experience, we're looking to sort of reshape the core, so that's why we decided to partner up with Memotext.
Cool, yeah. So what exactly are we doing? Are we just dumping technology on people for the sake of dumping technology on people? No. Let me describe to you what's going on in our healthcare system. Right now, we know we have an aging population. The prevalence of dementia is going to triple in size worldwide by year 2050, not just in Canada, but worldwide. And what this is doing is leaving our healthcare system vulnerable. We don't have enough long-term care beds. That's actually a fact. You and I probably won't have a bed. And what's happening is we have a shortfall, and this is also taking a big toll on our caregivers. Over half of them are experiencing distress. There's severe burnout, and they're committing about 26 hours a week on average to caregiving, which is unpaid work. And overall on our healthcare system, this is taking a huge effect of $15 billion per year in Canada. And so what we're trying to address is how do we help seniors age in place in the comfort of their own home for longer, and how do we address the caregiver and the care provider in all of it? So, introducing the Ring of Support. Here we are trying to address these three actors, first being the seniors, so how do we help them age in place? Then we go to the caregiver, how do we reduce the burden of them having to monitor their loved one? And then the care provider, how do we tie them into all of this? How do we help them identify risk earlier and be proactive about things? So I'll just briefly walk you through what we're doing. This is an Alexa-based solution where the senior is interacting with the Amazon Alexa device. We're providing daily wellness check-ins in the morning and the evening. It'll tell them about their day, the events on their calendar, any kind of messages from their caregiver, their morning routines or evening routines, and we're doing wellness checks. At the same time, we're doing custom set medication and appointment reminders, and this is all harnessing the power of voice technology. So seniors don't have to learn a new technology, but we're going through the Alexa device. And then as a secondary modality, we also have voice response calls, that are going if they miss their primary communication through the Alexa device. So then what's in it for the caregiver? Well, they can stay in the loop, and we're trying to really reduce their burden of monitoring. So we're providing real-time SMS updates about how mom and dad are doing. Did they take their meds today? Did they miss their morning check-in? What are their reasons for not taking their medications? Did they request to speak to a nurse? The caregiver is now in the loop. They can log on to a dashboard to check the trends over time. And we partnered with SE Health and Liz, which is their caregiving services arm, where we're harnessing their content, their evidence-based content, to provide little support bites where we're sending text to the caregiver on proper caregiving strategies, trying to address their mental health issues and physical activity levels and other things like that. And so now I'll pass it off to Joe about...
All right, so what are people saying about the Ring of Support? So we had a beta tester sort of use the Ring of Support for a week, and she absolutely loved that the Ring of Support's checking on how she's doing every morning and night, Also these medication reminders as well. She told me she doesn't have to leave her medication on the counter overnight, so she remembers to take it in the morning. Also the ease of use of it as well. So I heard this quote where before we had to understand the machines, and now the machines have to understand us. So with voice, it's very intuitive. We talk every day, so it's very easy for her to use. Even outside the Ring support, she didn't know how to set the timer on her oven, so she simply asked Alexa, set a timer for me. Even older adults with mobility issues, they don't have to worry about logging on a computer, using a keyboard. They can just use their voice. In terms of our staff, we have this one client that, every day they have to go and check in on him, just make sure he's okay, and then they have to drive to another client. With the Ring support, Alexa, it's able to do that just on its own in quick minutes. And if they need help, it can send a PSW, which leads us into how SE sort of plays into it with our community response model. So let's say someone says they're not feeling well during wellness check, or they miss a couple of medication reminders. Well, the Ring support will connect to our virtual nurse team at SE Health, and it will call the client to check on them and sort of resolve the problem over the phone. And if they can't, then they have the ability to send a nurse or PSW to their home. This is great not only for the client, but also caregivers as well. If you live 2 hours away from a loved one and something happens, obviously you feel that little guilt that you can't be there for them. But with SE, we're able to send PSW over to their home. So next steps for this project is we're recruiting around 50, 60 patients for user experience study. And an hour after our training session, we already have someone signed up ready to participate, and she's turning almost 100. So how does this sort of prepare SE for the future? So we're seeing the sort of Uberization of services, and healthcare is no different. I mean, we're already seeing services where you can speak to a nurse or a primary care physician on demand through the app. But at SE Health, we have over 9,000 staff members in the community. So we're leveraging that asset, and with the Ring support, it's a first step towards that community response model. And one day it can lead SE Health to deliver care, not necessarily every Tuesday, Thursday at 2 p.m., but when you need it. So let's say you need it on Monday, but not the Tuesday, or you need it 5 days a week, but not the 2 days. And who knows, maybe one day when predictive analytics is more accessible for everyone, we can send a nurse to someone's home before they even ask for it. All right, thank you for your attention. Open the questions.
This is awesome because just today I have a very scared vision about my future as an elder without kids. So it was this woman with 2 chairs in the doctor, the physician, family physician, and she was like an hour there looking for something in the back and occupy 3 chairs. And then her husband, they were probably 85, 90. Well, 85, let's say. And the husband said, "Are you ready?" And she said, "No, I haven't seen the doctor." And the secretary of the doctor said, "No, man, you already have seen the doctor." So, and what were they looking for? "Oh, because I need your address." And then the secretary said, "Probably your husband knows the address." And he said, "No, we don't know it. I don't know either." "And how did you come here?" "Driving." We remain all, even the secretary, scared about what was the future of this couple of elders coming back home. You don't even remember the address or know the phone. When she asked for a phone, they look at the back and find a phone probably of the 80s, like a cup that way. So how these people is going to use Alexa? They don't even know how to use a smartphone.
Do you want to speak to it, or I can answer?
I mean,
Okay, yeah. So,
I'm putting this example because they have a lot of issues.
yeah, so, you know, with the smartphone, you know, you need very fine motor skills, you need to understand which buttons to press. But with Alexa, so you simply say with our skill, Alexa, open ring support. And let's say it's a morning check-in. It'll say, oh, good morning, you know, today's the date, the weather, and then you just speak to it, like, how are you feeling on a scale of 1 to 9?
But since they don't have family, like
Oh.
this couple, it seems that they don't have children, so family.
Oh,
Are you going to look at these couples that are alone? That's going to be probably my future with my wife if I don't have kids.
So during, like, with the tech setup, obviously, we're there to help them along the way. But actually using it day to day, you just simply ask Alexa to do the things that you need to do. Like that one beta tester that didn't know how to set the timer on her stove. I don't even know half the time. But I use my Google Home, just, hey Google, set a timer for 15 minutes. Super, they've been speaking for, you know, all their lives, so it's very intuitive in that sense.
I think that this is such an amazing idea. My mom is a full-time caregiver, and it is a huge burden on her, and an idea like this would even allow her to go out for an hour and feel a huge sense of relief, so it's something that's really important to me. I also know that my grandpa, though, is very resistant, so I'm curious to know how you guys will kind of fight that resistance in the elderly population when, you know, kind of difficult technology comes into play. So how are you guys going to try and kind of combat that to ensure that the users are able to, you know, effectively use Alexa?
That's a good question. Do you mean resistant in terms of?
Just in terms of, I think, like technology.
Okay, yeah, so the purpose right now is actually a usability study. We're not looking for outcomes right now. Really what we're trying to evaluate is the user experience with senior or older adult interacting with an Alexa device. So what is it like for them to interact with this kind of third party? We might actually find that they reveal more to this device than they would to their caregiver. I know my grandma lives with dementia, and she would never tell my mom, you know, if she's taken her meds, but we'll try to evaluate that experience. And because we are a startup company, we can be agile. Because we're working with SE Health, we can do iterative rounds. So I think that's what we're trying to learn, actually.
Also, as well, there's a report released that in the U.S., the older population are the fastest adopters of this smart speaker technology. So, yeah. Okay, awesome. Thank you.
Thank you so much.